everyone. My name is Anjali Kauser, and I am the CEO for the Cupertino Chamber of Commerce. Our topic of discussion today is your health and opening of business. We are talking with Dr. Mark Adams, who is the Chief Medical Officer for the Camino Hospital, and who is also a resident of Cupertino. We are so excited to have him here today. But before I turn it over to him, I would like to remind everyone who is joining us today to please write your questions for Dr. Adams in the question and answer tab, and we will answer them after his presentation. So now over to Dr. Adams.
Welcome everyone. It's great to be here on a Monday morning to get the week started. I really appreciate the invitation. And let me get this set up for you. Here we go. So we're going to talk about a number of things, basically geared toward, how do we get back to business? That's, I think, what on everyone's mind. And so, let's get to it. I'm going to give you a little bit of overview about COVID-19, the virus itself, how it behaves, what it does, and because that really ultimately influences how we deal with it going forward. So this is what it looks like. If you happen to see it, don't touch it, don't go near it. But this is, if you really want to know what it looks like, this is it. This is why it has the name. It has all these weird things on top of it. And, the symptoms, there's been a lot of discussion about, how do you know if you have it? What should you be worried about? And I would say there are some peculiar symptoms that have shown up, but generally speaking, fever, cough, shortness of breath, those are really the hallmarks of COVID-19. And you can see here the cold, common cold, flu, allergies, there's some overlap in some of the symptoms, but generally the shortness of breath in particular is something you don't usually see in any other of these. And so that's really sort of a good indicator of what might be happening. I will say that, there has been this year a lot of flu. And so a lot of the people really that we have been looking at in terms of medical care actually have turned out to have the flu. And just so you have an idea, and this is to me really important because there's a lot of sort of hype out there about, is this deadly? What's happening? Is this like the swine flu, the pandemic of 1918? Well, here's kind of, if you look at the x-axis at the bottom, what you'll see is the average number of people infected by each person. It's called R0. I'll come back to that, R0. And you can see that the coronavirus is not that infective compared to others. Look at the measles on the far right. 15, a score of 15. Measles infects everybody. It's very quick. It's airborne. It's easy to catch it. This is not like that. And if you look at the y-axis on the left, that's the rate, the fatality rate, or the percent of people that die from having the virus or the pathogen. And by the way, that's a logarithmic scale. And so if you look, the coronavirus, it's somewhere in that red box. It's probably now, I'll come back to that, on the lower side. But look at the top, things like Ebola, 70% of people died. Bird flu, even worse, 80% of people died with it. The Spanish flu, which was the pandemic, of 1918, that was a 10% mortality. This one is not in any of those ranges. It certainly, people have died from it, but it's not really that deadly compared to others. So the big question, how do you transmit it? And this is we'll get back to this in terms of how do you open your business safely. It's important to understand this. It's primarily transmitted by respiratory droplets. And that is, the virus gets into the moisture that you expel from your respiratory system. And I put in here, there's a variation, a spectrum of the chance of having virus in respiratory droplets, and the amount of droplets that are expelled depends on this sort of spectrum that I put here. So normal breathing, all of us right now, we're just breathing normally. The chance of that spreading or coming out in respiratory droplets is extraordinarily low. So just talking to someone generally is not that big a risk. But as you go off this down this sort of spectrum, heavy breathing, talking loudly, singing, coughing, and finally sneezing are activities that really expel respiratory droplets. And so it's important to think about that. Um, the R0, the R aught I mentioned, the score is 1 to 2, which means one person generally can infect one or two others. Again, it's not that much, but this is why social distancing is so helpful, because if you can keep that distance between people, particularly if you're in an environment where people are talking loudly or singing or coughing, this really keeps those respiratory droplets away from you. And then the other thing you don't see probably much in the press, so now you're going to be all going to be experts and impress your friends. There's something called a K factor, and that is the ability of a pathogen to cause clusters. And it looks like COVID-19 actually has a K factor that's pretty low, and the lower it is, the more clustering it does. So think about in Japan, that one person who, when they opened up the nightclubs, visited a bunch of nightclubs, and in one night, that one person infected 80 people. That's clustering. And the Washington State, you probably read about that. I think it was Fall City. It's a small area where a choir was practicing, and they were singing together for about 2 hours, and 53 people got infected out of the 61 from one person. So that's clustering. And this is why this social distancing is so important, because what you really want to avoid these clustering events. The nursing home in Seattle, one person infected all those people. So again, it's really important to keep that distance. And so the other piece is it is possible for people that are not sick to transmit the virus. It is possible. It's less likely, but it is possible. And then masking, we'll come back to that again a little bit. The whole purpose of masking is to prevent people from infecting others. So the mask is not designed to protect the person wearing the mask. The mask is designed to protect others from you. And so I have to wonder. I'm intrigued a little bit about some of these people where it's become a political issue. It's my right not to wear. A Constitution says I don't have to wear a mask. It has nothing to do with the person wearing the mask. You are protecting others, and I'm pretty sure you don't have a right to injure others. So I don't know. I can't solve that. I get a conflict, but just remember the masking is to protect others. Okay. So just quickly, here's kind of where we are. This is changing every day. This is now, I think, a couple days old, but you can see we're over 100,000 deaths in the U.S. Worldwide, 6.63 million. The pandemic of 1918 infected over a third of the world's population. There were 50 million deaths. And so, we now have 7 billion people in the world. And so, 6 million is a lot of people, but it's really a tiny fraction of the world's population. This is interesting. I thought you might want to take a look at this, that for March and April, the cause of death, so it's a real issue, right? That the third leading cause of death in the United States in March and April was COVID-19, below heart disease and cancer. And so, it will drop back down again, but you can see it certainly has had a significant impact in the relatively short time, that we've had to deal with it. Here's where California stands. We're going to start to now get closer to us. California itself has, about 120,000. Remember, these are confirmed cases, and generally speaking, most of these come from people that are sick. And what we have discovered is there's probably a lot of people that have had the virus that weren't that sick, so they never sort of factored into these numbers. But you can see the number of fatalities, and that big circle you see is Los Angeles County. The rest of California actually has done well. I think if it wasn't for LA County, California would be pretty far ahead. Here's what the University of Washington Institute of Healthcare Metrics and Evaluation, this is what they have been predicting for California all along. They've been very accurate, I will say. The solid line is the actual deaths, and the dashed line is the projection. And so every day they update their projection with real data, which I think is why this is a good one. And you can see that the curve has really flattened out. That big shaded area, though, is beware. That's if we totally forget all the precautions that we continue to need to do. We can easily end up at the top of that shaded curve, and that's where we don't want to be. So while we do want to, get back to business, we want to do it carefully. This is the total deaths in California. And again, you can see 13,000 projected. And this has gone up a fair amount over the last couple of weeks. Again, mostly because of LA, not so much here. And what's happening in terms, you've heard that older people are more susceptible. That is true. However, this I think is interesting, that if you're really old, actually, you're not quite as susceptible, probably because the biggest factor really is pre-existing or other illnesses. That's really the biggest driver. So if you are 90 years old, the chances are you probably don't have a lot of other disease. And so we've actually taken care of a couple people in our hospital that have been in their 80s and 90s and actually went home and recovered just fine. You can see males are more likely to die. And again, this is what I was saying, that 89%, that's the biggest driver. People that have one or more other illnesses, whether it's emphysema, chronic lung disease, heart disease, diabetes, anything like that contributes to the increased chance of dying from it. And we've seen that pretty consistently. And then here you see deaths by long-term care facilities. And you can see at the very beginning on the left, the mostly blue, that was community acquired. And then as we sort of got that under control, we've shifted our long-term care facilities, nursing homes, had a real run also. Those are the sort of tan or salmon color, whatever that is. But you can see that also has trailed off nicely. And so we really are now getting into a much more stable situation. Here you see the Santa Clara data county at the very bottom. I look at the very bottom, that what you can see, those are the number of new cases per day. And while they have trailed down nicely, you see there's still some fluctuation. We still occasionally have some increase in cases, but it's been relatively low. And that's a really good thing. And that's why we're really, and you can see here 0 deaths. That's really why we're now in a position to lighten up on all the sheltering in place enforcement and business. Just to give you an idea, there has been quite a bit of variability, not only across the country, not only California, but even in our own county. Excuse me. There's been quite a bit of variability. The lighter areas have fewer cases, the darker areas have more cases. And you can see Cupertino actually has been relatively spared from COVID cases. The rate is per 100,000. So Cupertino has had a rate of 46 per 100,000, which is really very low. Mountain View is a little higher, about double. And then if you look at San Jose, much higher. And so again, a lot of this has to do with where you live, what's the density of the population, how are people being responsible and doing all the things, the sheltering and the washing of the hands, all the things you're supposed to do. There is definitely a behavioral component to this we've seen here and across the country. So it's very interesting. But Cupertino actually has been really light. So now, how about us? Here's our own experience at El Camino. Just so you see some real data from right around where we are. These are the number of cases in the hospital at any one time who are COVID-19 positive. And you can see we really have flattened out. We actually had a recent little blip, not unlike the graph with the county. We currently have 3 patients in the hospital with COVID-19. We actually just had our first mother deliver a baby who had COVID-19 with symptoms. She actually did fine. Baby did great. Mother did great. They all went home and are doing well. But this is what we've seen. Like I said, it's been pretty low, but we will continue to have a few cases now and then. And then here's our experience. We've now tested over 3,000 people. It's interesting that, so the people that mostly we test are people generally that have symptoms of some kind. And as you can see, the actual number of those patients who have been positive, it's about 4.1%. And so again, most people who have had respiratory symptoms actually have had something else, not COVID-19. I know that sometimes people are thinking, well, I must have had it because I had some, coughing and fever. It's the probability is you didn't, because most people have not, and you can see this is our data. The number of patients we had to admit, you can see 45, but double that, or patients actually were sent home to basically just ride it out at home. And then mortality, and this is of the patients that were positive, is 5%. Now, what we've learned is that, and this is why some of this data has to be interpreted carefully. So the data on the deaths has to do with people that were diagnosed and mostly had symptoms. So when Stanford started this, they started doing epidemiological studies to look at the prevalence in the community. And when they looked at Santa Clara County, and they basically, and by the way, they did this with antibody testing, they found a much higher number of people who have had COVID-19 than is reflected in people who showed up sick for medical care. And so based on that, the chance of dying in general is probably about 0.2 to 0.3%. And the flu, the generic flu we see every year is about 0.1%. So it's a little higher than the flu, but not that much, and nothing compared to what we originally had thought at the outset. Now, there was some criticism of this, but subsequently USC actually has done the study, and then they did it in New York as well, and really have confirmed that this is probably the mortality rate because it is much more prevalent than those people that showed up being sick. Very interesting. So what about testing? Everyone talks about testing. We have really lagged behind, and that's been a problem for all of us to get a handle on this illness because of lack of testing. That now is getting a lot better, which is a good thing. The PCR is the test, polymerase chain reaction. That's the test that detects the virus itself, and it's very sensitive, very accurate, and that's still the primary way of testing people. Now, antibody testing is available. We have it at El Camino now. We can test for antibodies, but here's the problem. We're not sure what it means. It certainly means your body has reacted to COVID-19, so you have been exposed. But what it doesn't tell us is, are you immune? Are you still infective or not? We don't know. You could be. We're not sure. So right now, by and large, it's used for, again, epidemiological purposes to kind of track the prevalence in the community. But so far, it's not really that good in terms of trying to test to see if people are quote unquote safe or not. There are a lot of antibody tests out there. There's a picture of one. Many of them are faulty, so we have to be really wary about them. And there's really only a few that have been approved by the FDA so far. And that's really important that they be tested and approved before we rely on them. And the other thing, it takes about 10 to 20 days for the antibodies necessarily to show up. It does vary. So again, you could still be able to infect someone. So we have to be, careful about how we interpret that. So where are we now? Well, here's the latest from the Santa Clara County Health Officer. Um, and basically, we still have shelter in place, but now a lot more exceptions. It's been lightened up, as you know. Outdoor dining now is now newly available. In-store retail shopping now available. All recreational activities available, and then of course manufacturing, warehousing, logistics, all available. Healthcare has always been available, although I think a lot of people have been afraid to come to a hospital, but there's really, hospital is very safe, and I'll show you, I think, some statistics on that as well. But but now we are, lightening up for sure. And so, how do you, as we lighten up, how we get back in business? It's very important to understand that we could face a resurgence very easily. And so we want to make sure we're doing those preventive measures that are important. So, you've heard, I'm sure, all of this before. Avoiding contact with people that are sick, avoid touching your hand and face, washing your hands. The social distancing does really work. The masking, now masking, again, it protects others. Masking is most important in a closed space. So if you're outside, as long as you're not in contact with someone, you keep the social distancing. Masking really doesn't make a difference. It's not that important. And that's why in Santa Clara County, we have not had mandatory masking outside, because that doesn't really help. But indoors, excuse me, in a closed space, absolutely, yes, it does make a difference, because you want to keep that closed space safe as possible, and so masking is used. So, for example, even in the hospital, every visitor that comes in, which by the way is limited, once they pass the screening, no fever, no respiratory symptoms, etc., everyone wears a mask. And again, because we're in a closed space and we want to protect others. Gloves, I would just touch on that. I see people around town wearing gloves, driving in their car with the gloves. That really is not very helpful. In fact, it's probably harmful. So if you're, so I'm a surgeon, if I'm doing an operation, I wash my hands, I put on the gloves, I do the operation. What's the first thing I do after the operation? Throw the gloves away, wash my hands again. You can't keep wearing gloves all day long, because eventually you're going to spread the virus around. Everything you touch, then you're going to be touching other things, and you're going to be touching your face with the gloves. It's not a good idea. So unless you're, using them like a surgeon uses gloves, you really should not be using gloves. I see people driving with them and all that. That's not a good idea. It's important to wash your hands, and basically do that is much more important than wearing gloves. So anyway, so you can think about that. You can tell people if you see them. So, excuse me. In terms of, so for businesses, here's what matters. So you need to consider the space that you have to work with. So one is maintain a disinfected environment. So these respiratory droplets, they generally don't remain in the air for very long, but they do settle, and they can be on the surface for a limited time. And no one really knows how long. There's all kinds of studies looking at that, but most of them, those are laboratory studies, and so they don't really tell us about real life. But in general, you want to keep the surfaces clean as possible, and so disinfect them on a regular basis. That is important. So for the workers, for your workers, they want to be protected from the environment, and that's keeping the environment clean, but also from the customers. Again, I think that's where masking and also having some barrier. If you can't keep that 6 feet at least of distancing, then there needs to be some protective barrier. As I think you've seen, if you go to a grocery store like Whole Foods, you'll see our plexiglass barriers for the cashiers, and that really is very helpful. Because again, if you can't keep that social distancing, then some kind of barrier is helpful to keep people safe. And of course, customers, they want to be protected from employees and the environment. And so again, I think, as we've seen, even in the hospital, where, people are reluctant, are reticent to come in, we now, emphasize that we have a very safe environment, and this is how we're doing. And I think even sort of showing, having a sign, that just reassures people that, we're taking the best effort that we can to keep everyone safe. And I'll just mention the liability issue because I know this will be a big thing for businesses, that there are now a number of issues and expectations, and so it is important, to be careful about that. I do personally think there needs to be some liability protection in the long run, because I think it's unfair, because there have been so many unknowns in this, to blame, to start to blame business and start all kinds of lawsuits. I know there are some trial attorneys that are salivating over COVID-19 lawsuits, but I think as long as we're meeting and following the recommendations, there should be some immunity. At least that's my opinion. So how do we sort of keep things going? Here's the countermeasures for you to think about. Look at the space that you have. Make sure you have some way of routinely disinfecting the surface. Put in barriers if you can where social distancing is not possible. Again, trying to keep people apart is really important. For workers, monitor their symptoms, check their temperature. You can consider testing options. I will say, at least for us in healthcare, we have tested all of our physicians, nurses, hospital workers. We've gone through and tested all of them. And I think, it's something to consider. It's not necessary, but definitely, regardless of whether you test or not, you want to keep track of the symptoms, and particularly fever, over 100. That person really should not be coming into work. And again, if they have symptoms, cough, shortness of breath, again, you really have to screen people out. And I would say that includes customers as well. And then for customers, masking indoors really should be a requirement. It's unfortunate. I know businesses get stuck, having to enforce this. But I think it is important for every other customer to be protected. I think it's a requirement, at least for now, we should be making. Of course, the exception is when you're eating. That's difficult, unless I suppose you could use a straw. But anyway, I do think that will be with us for a while. And legislative immunity, I'm sure there'll be more talk about that, but I do think that will be important. So here's a key thing I think all of us need to be thinking about. I know we are in healthcare for sure, and that is as we lighten up on the shelter in place, it's very likely we will have some recurrence or some resurgence of the disease. I think there's little doubt about that. We are not going to have herd immunity. People talk about herd immunity. We're nowhere near that. You need about 70% of the population to have had the illness and to have some form of antibody immunity to have herd immunity. And it's going to take us quite a while to get there, particularly since we're controlling it so well. That's the trade-off, right? We're keeping it under control, dampened. That's good, but it also keeps us from getting herd immunity. And so we're going to have, and the vaccine, people, I don't know, generally it takes 1 to 2 years at the very least to develop a vaccine. People talk about rushing it. I don't know. I'm skeptical, I have to say, because it does take time to really get an effective vaccine, to be sure it works, make sure it's safe. It's not something you can really rush. So the point is, and that's in red, we are going to have to do business, learn to live with the COVID-19, and do both. It's critically important that we get back to business. I think everybody understands that, and we must do it, but we also need to do it in a way that we are going to have to live with this virus at least, for the next year or two. So, live with it safely is the key. And so I think following these sort of guidelines is going to be really important. And then finally, as we do this, as we go forward and live with the virus and do business with the virus in the community, we're going to have to identify and contact, trace, and sequester people that are positive. This is really vitally important. And I believe the county, is starting to gear up. Last I read, they're maybe a little behind, but we need to be able to, anybody that turns up positive, we need to do, figure out who they were in contact with, and we need to isolate those people. That's the only way that we can really go forward and be open for business, and at the same time keep the virus under control. Remember, at the very beginning, we did do that back in the end of February and March, but then as more cases occurred, we sort of lost the ability to do that. But now we need to get back to that. It's really important to really isolate people from others when they are sick. It's going to be really important. And before I go through, I will say, just so you have an idea, as we tested all of our employees and physicians, we, by the way, found no physicians that are positive out of several hundred. We had a couple employees that were positive. They were all from community contacts, but not from contact in the hospital. And again, that was a handful, 4 people, I think it was. We are testing patients that come in for elective procedures. We have turned up a couple of patients that were positive, and they didn't know it. They were asymptomatic. So we are being very cautious as we are back doing regular elective procedures, but we're also being cautious about testing people. So here we are. And not that this maybe sums it up. If we begin with certainties, we shall end in doubt, but if we begin with doubts and are patient with them, and that's the key, we shall end in certainties. We will get through this, and I'm confident about it. But I do think we also have to get back to business, and that's really important. And so we just need to do it, be very conscientious, and do it in a safe fashion. Okay, so what questions do you have?
Hey, Dr. Adams, what do you think is our general immunity gone down also because we have been sheltering in place for the last almost 3 months? So have we all maybe don't have the immunity that we would have had otherwise?
Well, our general immune system function is fine. That really doesn't change whether you're sheltered or not. But what we don't know is, first of all, many of the flu, right? So we get flu vaccines, for example. Hopefully, the reason we get flu vaccines every year is that there's not always immunity from the flu. So if you get the flu one year, you can get it the next year if you don't get the vaccine. Common colds, which, by the way, many common colds are caused by other coronaviruses. You don't get immunity to those. So we don't really know if there's going to be immunity or not. I think there's a good chance because there are antibodies being generated. But really your best chance of immunity in the long run will be a proper vaccine, because those are designed to trigger your body's immune system in the right way. So, but I think the sheltering at home might make us less physically active and out of shape, but your immune system will still be fine.
Okay. Another question we have is, are you aware of any legislator currently working on a legislative liability reform?
Well, I know Congress is. Definitely. I know there's been a lot of discussion about it. Of course, there's always arguments about it. Um, how far do you go? What's the right way to do it? But there's definitely been, my understanding, a lot of discussion about it um, in Congress.
Okay, thank you. It was in the news yesterday that New Zealand is coronavirus free. So how do we understand that? Like, what does that really mean?
What is coronavirus 3?
New Zealand, the country, New Zealand, they
Oh,
had a they said that they were free of the virus. So what does that mean? Do you
oh.
know?
Well, I mean, so think about Ebola, right?
Mhm.
So Ebola, which was extraordinarily deadly, but it was fairly well extinguished completely. It now has had some resurgence in Africa, but it is possible to extinguish a virus like that, particularly if it's the paradox with pathogens like that is the more deadly they are, the easier it is to eliminate them because if they kill their hosts quickly, then they don't have time to spread. On the other hand, this, like COVID-19, which has a very low mortality, is spread fairly easily. Those are much harder to extinguish. And so it's very difficult. But, if you really take an extreme lockdown approach, it is possible over time to extinguish a virus like that. But here's the problem. Today, everybody travels, right? We have a world that travels. And what about Santa Clara County? Why did we have one of the first cases in the country? Because there's so much travel here, right? People going to China, people coming in and out from all over the world here in the tech industry, and that will come back at some point. So, I don't think in today's world, no country is really completely safe unless they just ban all travel, which isn't very practical.
Um, right. We had another question that says, have US healthcare been following the Swedish approach?
The British approach. Well, there's definitely different approaches. I mean, Great Britain was slow, I think, to the game, and then realized that they really had to shelter. And so I don't know that they're that much different. I think the country that people talk about the most is Sweden. Sweden's approach, they did not do the extreme shelter in place. They allowed business to continue, but to take precautions. And again, wash your hands, wear a mask, do all those things. They have had a much higher mortality number than their European counterpart countries. But on the other hand, they never shut down their schools. They continue to do business, and they are sort of coming out of, light at the end of the tunnel at this point. So, I think there's trade-offs there and approaches. I think, the shelter in place made a lot of sense for us early on, but again, you can't do it forever. You have to learn to live with the virus, and that's, I think, where we are right now. If you look at New York City, there they had an extreme increase, and now, they're calmed down quite a bit. But again, they'll get a resurgence as people start traveling.
Okay. Well, with that, I would like to thank you for being with us today and providing us such valuable information. Um, Thank you so much, Dr. Adams.
Oh, you're welcome. Thanks for inviting me. I really appreciate it. And I enjoy
Thank
living
you.
in Cupertino, so I want the businesses to get back in business so I can use them.
Thank you.